Head and neck cancers are tumors that arise from locations between the skull base, which is around the level of the eye, and it extends down to the root of the neck, which leads into the chest. These tumors include tumors that arise from the thyroid or salivary glands. We also find tumors in the nose, but more commonly we find tumors in the nasopharynx, which is the area behind the nose. There are tumors arising in the oral cavity, also referred to commonly as the mouth, or the oropharynx, what we call the throat in layman's terms. There are tumors that arise from the voice box as well. We refer to them as cancers of the larynx, and tumors that arise in areas that lead down to the esophagus, what we call the hypopharynx. One of the most common symptoms of a head and neck cancer is a neck lump. There are also other lumps in the mouth or throat that you should be aware of. If these lumps persist or continue to grow, then you should be concerned about the possibility of the presence of a head and neck tumor. Ulcers that do not heal or bleed on contact is also another sign to be concerned about. There are also symptoms such as bleeding from the nose or blood-stained phlegm, which could indicate the presence of cancer in the nose or nasopharynx. Another symptom which you should be concerned about is if you have hoarseness for more than 2 weeks. Although hoarseness is usually caused by benign conditions such as laryngitis, persistent hoarseness could be a symptom of cancer of the larynx. Other symptoms which you should look out for are throat discomfort, difficulty swallowing, or a persistent unilateral blocked ear or nose. There are many causes of a neck lump, but one of the most common causes is due to an enlarged lymph node. The other common cause of a neck lump is the presence of a nodule in the thyroid gland. Tumors arising from the parotid gland or the submandibular gland can also present as a neck lump. The parotid gland is a salivary gland that is located near or at the angle of the jaw over here, and the submandibular gland is located in the area just below your chin over here. So if you have a lump that is arising from this region over here, or just under the chin or jaw, it could well be that you have a tumor arising from one of the salivary glands. Finally, there are some cysts in the neck, such as branchial cysts or thyroglossal cysts, which can present as a neck lump. A branchial cyst is a congenital cyst that is usually located in the upper part of the neck, which is somewhere around here. And a thyroglossal cyst is again a congenital cyst that is more in the midline upper part of the neck, and it's located usually around this region. The thyroid gland is a butterfly-shaped structure that lies in the lower midline of the neck. It is located below the thyroid cartilage, also known as the Adam's apple, and it moves with swallowing. So therefore, any nodule or growth that is in the thyroid gland will also move with swallowing. A person presenting with a thyroid nodule should have an ultrasound done to ascertain the size and characteristic of that nodule. With guidance from the ultrasound, a fine needle aspiration biopsy can also be done. We also do thyroid function tests to determine the functional status of the thyroid gland.